Let's kick this off. We've got Dr. Squared. We've got Dr. Gary Lindbergh, who is a PhD in physiology, lots of experience and knowledge about all things physiological. And then Dr. Ash, really grateful to have you as part of our team. Osteopathic. I think that's just a really neat philosophy to have versus some of the other disciplines and doctors. And just I guess that's looking at the whole and rather than just cause and effect of one little thing. And so I think that really is the original medicine, really, that Hippocrates and other people had, was looking at the big picture of things.
Well, the interesting story behind that, Dave, that I probably have never shared, was the man who started osteopathic medicine was a man by the name of A.T. Still, who was actually an MD. His family was very wealthy, and they had put together Baldwin College in Kansas. And when he was practicing in the late 1800s, he didn't think that leeching was like the right thing to do. And so he basically, he basically had some problems with how they were practicing medicine at the time, and he decided that he was going to do a little bit of research. And so what he did was he went in and he robbed graves, and he studied the bones that was obviously the only thing that was left, right? And he got so good that he would put different vertebrae in a box and reach into it with a hole from a hole in the dark, and he would be able to tell what vertebrae it was. And then he started to feel the back and the parts of the body, and he believed that structure dictated function, so that if your structure was good, and your function would be good. And he didn't even exactly know what he was doing, but he was aligning the structure, and that was having the function, because you see all our lymphatic tissues run up and down the spine, and the nerve that goes to every organ in the body basically comes out of the spine. So everything that runs in the body comes from the spinal cord, which is housed and protected in the bones. And so he was so excited. He went back to Baldwin College to tell everybody about his new findings, and they like pashot him and threw him off the podium. And so he came back to Missouri, and he started to be an itinerant physician, that back in the days of the visiting doc, right? And he went from house to house to house, and the interesting thing was that because women were the caretakers of the family, of course, right? They're the ones that are home while the dads are out, working on the farm, the ranch, etc. He had all kinds of women that he taught what he knew. And so when you see pictures of him, he's standing in front of a cadaver, and he's got like 6 or 7 women around him, and he's teaching them. And he really got very good at what he did, and they had a huge flu epidemic. And the interesting thing was that his patients didn't die at the same rate that the other patients did, and partly it was because he was impacting the structure of the spine, which then improved the flow of the lymphatic tissue in our immune system, and the body healed itself. And so that's where our philosophy of give the body what it needs and it heals itself. And every once in a while I'll get a patient who doesn't know what an osteopathic condition is. I had a cute little lady this week. she was 92, and I had seen her, and I had made the right diagnosis on her problem, and they had come back because they weren't able to see their regular physician. And she looked at me and she said, "Well," she said, I think I'm going to have to see one of those geriatric doctors." She says, "You're a DO, and I don't even know what that is."
Yes. It's a do.
And so I said, well, kind of the short-term definition of a DO is if you put an MD together and a DO and a chiropractor together, you get a DO. We get about 450 extra hours minimally in the musculoskeletal system. So I thought that was pretty cute, and I had to laugh. And it was even more funny because where I work, we have an osteopathic residency program, and so we have a number of residents. So pretty much everybody she sees has got a DO resident or is a DO, and she has no idea. But the other comment that I had from some other patients were that they really appreciated the fact that, that I kind of looked at all of them, and I hadn't made a comment about that. I was just doing what I do, and they noticed. She says, you see other people, and they won't touch anything else except their particular little spot. And she says, you're like hooking this up to that. And so it was, that is what I love about my profession. And that is exactly what attracted me to Nikan, because it was really about the whole person. I love the prevention. I do the fix it after it's broken medicine, but I love the prevention piece, and I would much rather teach people how to be healthy than I would to prescribe a medication. And as I've said to them, you know, if you don't want to take medication, then you have to do some things to take care of yourself. The self-care, exactly what you talked about, Gary, exactly what it is that we're teaching. We have to be responsible for our health. The other piece of that is that I get probably 5 to 8 recruiters contacting me a day, 6 days a week. There are not enough physicians for the number of patients that there are out there, and because we baby boomers are going to be living longer and we're going to be having more illnesses, we're going to be using up that health care, and that's going to mean that we can't get appointments. And what's happening where I'm working is they have a system called open access. Open access means that if the provider's got an empty spot, you get put in it. And the issue with that is that everybody thinks a provider is a provider is a provider. But what they don't realize is that when you see the same person ongoingly, we do a better job of being able to look at the whole person, being able to figure out what the problem is, you know, get outside the box if we need to. And so when you just see somebody for the first time, it takes us almost most of that appointment to just get the picture of what's your background, what's your issues, what's your medications, etc. And so what happens is when they move from, you know, they can see 6 different providers in a half of a year, and they don't think it's any different, but I promise you it's routinely different. What you need to have is the same provider, and then you need to be educated enough and tell your provider what's going on and tell them about the natural things that you're doing. And sometimes they're going to listen, sometimes they're not. You know, we're pretty inundated with gotta have evidence-based medicine. You know, how many studies? And I love Rick Murphy's comment. He says, well, do we need a study about how important air is?
Yeah.
No. Do we need a study about how important water is? How about sleep? You know, and he's absolutely right. So so a lot of times people will ask me, well, okay, certainly healthcare professionals are going to really love this when they're brand new. Let's go talk to all the doctors, etc. No. They're the toughest. Go there last. You know, leverage me, leverage folks who've been around in the business for a while, and then they're going to be pretty analytical. And back when we used to have Cindy Worry, is that her name? Her 2,400 page CD. Those analytical people, we would just hand them that and say, here you go, take a look at it. Got any questions, give me a call, and then go talk to 5 or 6 other people who are looking for self-care, who are looking to help.
And you can always ask for them to prove to you the benefits of bloodletting or leaching. So. Yeah.
Well, then somebody said, but aren't we going back to that now? I said, yeah, you know, I think I heard that. Oh, my goodness, yeah. So before we start answering some questions, let's do the disclaimer. So even though I am a physician, licensed to practice medicine without restrictions, we as Nikan consultants do not make any medical claims. It really is about giving the body what it needs and it heals itself. And so what I try to do here is to think about what the process is that somebody who has a problem, who has a disease condition is, and then say, okay, what is the body probably lacking that if we gave it, it would give it a jump start. And the other thing that's different is that in between Western medicine and using self-care is in Western medicine, we like to just do one thing at a time because we want to see, you know, all those side effects you see on the commercials on television. We want to see if some of those side effects happen. And if you have a problem, if we started you on 2 or 3 things, we wouldn't know which one was the problem. So that's how we do it in Western medicine. But what we find in health is that the body is, and maybe you can talk about this, Gary, you know, the body needs all of the things to have it work right. And I always tell the story about the Krebs cycle, which those of you who have ever had any biochemistry, it's this big, long circle of all these rate-limiting steps of all the things that have to happen for metabolism. And it has little things like vitamins and minerals that come in. And if you're missing those vitamins and minerals, then that process can't continue and finish. And to me, they're all important. Now, in a test to a biochemist, there's only 3 rate-limiting steps that are the test questions. But to me, they're all important.
Well,
so,
we should show a slide of the Krebs cycle.
Yeah, wow about what it is we had to learn when we went through that. Exactly. And so with self-care, it's really about the body's got to have all those things, because if it's missing one little thing, it doesn't function at 100%. And that's why our wellness home is really so great, because we look at the areas. We look at whole food nutrition, pharmaceutical grade nutraceuticals. We look at the air that we breathe. We look at the sleep that we have. You know, we look at the energy that we have. We look at the water, and we're 70% water. So all of those things are important. And the more you add, 1 + 1 = 1,000, not 1 + 1 = 2. So any comments on that, Gary? I'll take a sip of my hot tea here.
Of your hot tea. Well, you hit the nail on the head. It's never just one thing. I mean, when you know, there's some general concepts that I think that are very important for anybody listening, any guest here to know is, and what I find, and Dr. Ash, you probably do too, when I'm asking people about how much water they're drinking a day, it's usually about half of what they really need to be drinking. You know, I had a gal the other day that came in, and Rex Olson and I were doing a meeting with her, and I just, you know, she came in with a bottle of water, and I said, well, I can see what your water choice is, but might I ask you just how much are you drinking a day? And she goes, I drink 2 of these. And I went, whoa, you know, that's like 24 ounces of water. You know, unless you weigh 48 pounds, that's not near enough water. And then from there, just from simple dehydration, a whole host of health issues arise. So you're exactly right.
Yeah, my visual is to say, okay, so if you had a brand new car and it was really dirty because you've been through mud, and I just gave you a wet sponge, you think you're going to get it clean? And that's what you're doing with drinking 1 bottle of water. Yeah. And then then the next question to ask them is, and how much coffee do you drink? Well, so they think about coffee, but we really need to say, how much caffeine do you drink? And then what about Red Bull and Monster and
soda,
et cetera, and sodas? Yeah. And, you know, not only the black sodas, but the clear sodas will have caffeine in it.
I'm sitting here at the Lodi Chamber of Commerce, and we have a self-care Saturday event. And when I came in to pick up the key yesterday, they have a group of students in the summer working, and I'll just tell this story real quick. It was pretty funny. And so one of the gals that worked here walked into their kitchen area, their, you know, little lunch area, and one of the students from Missouri was sitting there. And so the older gal that works here, one of the secretaries, asked her, what are you drinking? And she says, well, I'm drinking a healthy energy drink. And I was standing there, and she goes, I don't know if that's healthy. Dr. Gary, will you look at that can and see if that's healthy? And I just went through ingredient from ingredient going, not healthy, not healthy, not healthy. And then of course she has a plastic bottle of water, and I pointed at that and said, not healthy. It says, you know, and a whole conversation ensued of why it wasn't healthy. I mean, but every ingredient in there, and right there on the can, it said healthy energy drink.
I forgot to send Dave what you asked me last week, so let me repeat it. So basically, kind of the rule of thumb is look at something, and if the first 3 ingredients are sugar, fructose, or corn syrup, don't drink it. Yeah, it's bad for you. And
or eat it.
I had this very healthy young vegetarian come in, and she said, I don't eat it if it's got more than 7 ingredients listed. And she said, when they're chemical names, I don't eat it at all. That's probably even a better rule of thumb. So let's go to some of our first questions.
But if you can, send that, email that out.
I will, I'll do that.
That's great information for people. So.
Well, I don't see any questions right now, but maybe you could elaborate just a little bit more on that, Dr. Ash. Osteopath, that's bones. A lot of times when we first think of that, especially an orthopedic surgeon or something, you know, we break a bone and the doctor sets it, and you just kind of think of structure, and bones are to help us walk, to protect our organs, different things like that. But bones, physiologically, they're literal factories. They do all kinds of really important things. Could you talk a little bit about that? And then maybe just the uniqueness of the OsteoDens, our bone supplement.
Yeah. And certainly Gary's more expert about what the bones do than I am, but I'll start out by saying that our bone marrow is basically where we make our blood counts, and our blood counts are made up of our red cells, which carry oxygen, and our white cells, which fight infection. And the other thing that happens from bones is that we release calcium, and calcium is important for our vision. It's important for our heart function. It's important for our kidney function. It's important for our gut function. And we need to have at least somewhere between 650 and 750 milligrams of calcium a day just for our gut to function. So, you know, we talk about calcium, and if we're absorbing really, really well, kind of the rule of thumb I'm taught in medicine, correct me if it's changed, Gary, but a small person needs about 850 milligrams of calcium a day. They say that women need about 1,000, but when I look at all the statistics about what we need to just have our body function, I think 1,000 to 1,200 is important. And as we age, we don't absorb as well, and so we should be about 1,500 milligrams. I always try to keep things really simple for my patients because I can't give them too much information. They're not going to read War and Peace. They're not going to read Guyton's Physiology. So I say to them, so do you eat milk, yogurt, or cheese? And they you know, they'll just say yes. I said, okay, so here's the general rule of thumb. It's not perfect, but it's a ballpark. Each serving of milk or cheese or yogurt is worth about 250 milligrams of calcium. So if you're not getting at least 4 to 5 servings a day, and you're you're an adult, then you probably need to supplement. And the interesting thing, I don't know if you can find it, Dave, and put it back out there again, but a couple of years ago when OsteoDens first came out, Dr. Naidu did a fabulous conversation. I think it was on the Nikan website. It might still be there. I think it was with Dave Balzer, and he talked about how he developed the CalDens, which is the calcium supplement that goes with the OsteoDens. And what he did was he studied the physiology of the absorption of calcium and found that one type of calcium is absorbed in one part of the intestine, and the other part is absorbed in another part of the intestine. I don't know, Gary, do you remember anything specifically, or is there anything you can add to that? But he designed CalDens so that the two components of calcium, two types, were in there, so we had the best opportunity to get the most amount of calcium from his supplement that we had. So, Gary, any comments on that?
Well, it's just ionic or chelated calcium, and they're absorbed in different areas of the intestine. So, and actually we have both of them in the CalDens, which is really cool because very few products do that. So.
Yeah, and so one of the issues that was the comments that was made that were a lot of people were eating calcium, but they weren't absorbing the calcium. And when you don't absorb the calcium, then we always tell people who have kidney stones, well, be careful about your calcium, etc. But if you're absorbing it where it's through the gut where it's supposed to be, then that's gonna work. I mean, then we're not going to create that excess that as the body's trying to excrete it creates kidney stones. So the other thing is that he studied lactoferrin. There's 27 kinds of lactoferrin. Lactoferrin is the product that we have when we breastfeed babies. It's the part of our immune system in colostrum that we give to babies, and that lactoferrin is very, very important for all the mucous membranes of the body. And so he fine-tuned one of them, which was the gut lactoferrin, and that gut lactoferrin helps us to absorb all the nutrients that we have. One of the issues that we have today is that our food is not nutrient dense. It's nutrient sparse. And so we eat things, but we're basically starving because we don't have no nutrition, because our soil has been depleted and because we have chemicals which cause the body to not recognize something and not to absorb it. I used to tell the story in Wellness Previews that 50 years ago you could eat 1 cup of spinach and get X amount of nutrition. But now you have to eat 50 cups of spinach, and even Popeye doesn't like spinach that much. I don't know that young kids know who Popeye is, so I probably need to change my story. Yeah, here we go. So
I had a doctor once say, you really aren't what you eat. You are what you eat, digest, metabolize, assimilate, and eliminate. And all of those things are factors that we could probably talk for quite a while about. And lactoferrin, that does help a lot with all of that.
Yeah. And so the lactoferrin is put specifically with the OsteoDens to be able to help to absorb it. And the bone is a dynamic organ. It's constantly, building up and breaking down, building up and breaking down. And so if it's like if you don't put gas in your car, every time the tank gets empty, it's not going to run. Well, the same thing is true of your bones. If you don't put if you don't put calcium in, then what happens is the bones are not going to be able to release calcium to the other organs. And when we first started, I think it was pretty interesting because, you know, we were talking about bone health because of the article that had been published in the journals of osteoporosis. That's where he did his first study. And so we were talking about the fact that it was helping, that osteodense was helping with bone density. And before his revolution, we didn't really have anything in Western medicine except the bisphosphonates. And how the bisphosphonates work is they take the calcium that you have in your bones and they just keep it there. And so that calcium gets older and older and older. And just like my example once again is if you have a car with vinyl seats, when they're brand new, they're pretty flexible and they're soft and you sit down and they give. But if you let them sit in the sun for a while, they get brittle and they start to crack and break and tear, etc. So that's what happens with bones when you use a bisphosphonate. And when it first came out, it was the only thing we had that would really make a difference for osteoporosis, which was important because we were having lots of problems for patients who were having hip fractures, and many of them were dying because of the complications of the hip fracture. And so if we could stop that process from happening, that would be really great. But what we've discovered as a side effect of using the bone health was that people who were having irregular heartbeats were not having irregular heartbeats. And other things were getting better, and all they were taking was the bone health. Well, what's true is that we have calcium pump in the heart, and we use drugs called calcium channel blockers for blood pressure when we're trying to control blood pressure. And so that calcium release from the bones to get to the heart, to get to the gut, to get to the eyes, to get to the kidneys is all very, very important. And when you're taking a bisphosphonate, that release is stopped, so or decreased significantly. And so then the body as a whole is not getting what it needs. And so you see why I love this company, because we're talking about give the body what it needs and it heals itself. And so the eyes work better, the kidneys work better, the heart works better, the gut works better. I mean, there it is. You know, and Nikan finds proprietary products that maybe they don't develop. Then they create relationships with the developers of those products the way we have with Dr. Naidu, and then offers them to us to offer to people to improve the quality of their life. And because this is a natural product, it doesn't have side effects, doesn't have drug-drug interactions. It just gives the body what the body used to make naturally when we were young.
Side benefits instead of side effects.
Absolutely.
Anything on that bone stuff there that I just talked about, Gary, you want to add?
Well, it's just to kind of reiterate, and what I always say about bisphosphonates is that because of their mechanism of action, they pretty much starve every organ in your body for the minerals they need. And how can they function without that? And most of the side effects that we see manifested as such is really to the direct result of starving those organs for minerals.
Yeah. Which is basically how every drug works, is it interferes with chemical pathways that are supposed to be working.
And interfere with natural physiology, absolutely.
See, we're not taught, in medical school, we're not taught about this principle that we're discussing right now. So we are taught when you have this problem, you give this drug. And exactly, it interferes with natural metabolism and causes another problem. I mean, another area of that is we put somebody on a statin, and if you saw that chart that Gary and I were talking about, that almost makes me cry every time I see it. In pain. You know, it decreases the coenzyme Q. And so now, you know, we got on the bus because somebody taught us, oh, by the way, we need coenzyme Q, and so if you're taking a statin, you need to be taking that also. And I can't even remember about that metabolic pathway, but I remember that.
Well, I remember that brains are made out of cholesterol, and I like my brain. I wouldn't let a piece into my mouth to steal my brain.
Well, virtually every steroid hormone that's functional in our body comes from cholesterol. That's the basic building block for it.
Yeah.
So,
yeah. Anyway, we're building up quite a few questions here.
Okay,
so.
Stump the Doc. You stump Gary, don't stump me. What's your score, Gary? I think we're.
I'm not keeping score, Ash. I'm not keeping
something like that. I think they've got us twice and haven't got us twice.
Yeah.
Okay. Well, let's just start at the top here. A possible future customer has pancreatic cancer, chemotherapy, other medicines, anything that you would recommend to just help in this type of ordeal?
Wellness home.
You can't go wrong with that.
No, two words, Angela. They need it all.
Nican products don't work any better than the very best water, the best sleep, and the best air, and the best nutrition, which makes a lot of sense.
Okay, so here's my get with the Western medicine. Okay, I mean, and this is just my common sense brain that says, okay, we're going to go in, we're going to give this very powerful drug, we're going to just completely wipe out the good cells and the bad cells, and we give chemotherapy, and then we're going to make people so nauseated that they can't drink and they can't eat, and they're losing weight because of the high metabolism of the cancer, but they're losing weight because they have no nutrition, and we're going to starve their own soldiers so they have nothing to fight naturally with. Doesn't make any sense to me. You know, I mean, and we used to watch in the hospital that patients would come out of surgery and they couldn't eat for a couple days, and they would go 5 or 6 or 7 days before they would start any enteric replacement of nutrition. You know, then they'd really jump all over it, but they lost the battle for 7 days. And so when you think about what we have, when we talk about our foundation is Siaga, which has basically 21 different extracts of fruits and vegetables, no sugar, no extra water in it. It's just a nutrient-dense supplement, and it's just a little shot of it. Anybody who's nauseated could sit down a shot or 2 or 3 of that throughout the day and get some good nutrition. Our barley grass is a perfect food. I always say that, you know, that whales can live their entire life just on barley grass, and so thus could we, and you can actually absorb it if you just put it in your mouth. A lot of it will absorb, but it's just a little tiny bit. You could get it down and get some foundation. We need to have water that when we drink our water, we don't have to drink a whole lot of it to get some of it, because the body recognizes it. It doesn't have chemicals in it. It doesn't have preservatives. It doesn't have the BPA's, etc. The body says, oh, this is bad, I'm going to get rid of all of that. So it lets all the water go through in the kidneys and in the bowel, and it actually absorbs it. So you take that water in, and that water then will really hydrate. Now, one of the things that I learned with one of my roommates, and it was my bad, I know better. You know, she was going through really bad chemotherapy, having lots of problems, and so I thought, well, let me help her, and I'll put her on a Nican mattress. Well, I put her on a Nican mattress, and she thought I had beat her with a 2x4 from the top of her head to the bottom of her body. And I went, duh. You know, what I'm doing with that is I'm increasing circulation, and so now I'm taking the toxins that are in the intracellular spaces, and I'm bringing them back into the blood supply, and I'm removing the toxins. But when I do, it's like this huge load to the body. It's like when you run and you get a side ache. So don't like throw the kitchen sink at somebody on chemo. Start them out with water. Get them really well hydrated. Remember, it's magnetized, so it's going to do some of those good things that magnets do. But just go slow. Go good with the nutrition. Throw the J Green. Throw the Siaga at them. The KVB. You can make those shakes where they're kind of more concentrated, but it's going to give them really good protein. If you can sprinkle in the men's or the woman's, you can always open up things and sprinkle it into the drink. You don't have to swallow more pills, and it probably is going to get absorbed a little bit better. You're not supposed to do that with the men's and women's, because they designed that for the transit time from the mouth to the gut, so that it breaks down when it's supposed to, so it gets absorbed in the part of the intestine where it's supposed to. But as I say, the whole wellness home, but for sure the water and the nutrition as a foundation. Give that poor body some fuel so it can develop its own immune system. The bone health, we just talked about how important the immune system is. It comes from our bone marrow. That's where our white cells that fight infection are. Give them the bone health. Give them the immunity. Open little capsules of the immunity, sprinkle it into the shake. Give them the shake 2 or 3 times a day if they're not able to eat food. Don't worry about just the once or the twice. Get some nutrition down. So yeah, that's really super important. And just be careful about laying them right on the mattress right away till you have them hydrated and detoxed.
Okay. There's a lady who drinks a lot of coffee, uses RO water, and she has migraine headaches. Any suggestions? Quit drinking coffee?
Okay, well, so you have to be careful about that because what happens with caffeine, when you withdraw, yeah, man, they think somebody whooped them alongside of the head. So what I suggest to my patients is that they're going to wean down off the coffee. First of all, let me say that coffee is probably a habit, okay? And if they and a lot of times the body says I'm thirsty, or it says I'm hungry, and when it's really thirsty. So it doesn't give us necessarily the right signal. So sometimes when we're thirsty, we actually eat because we think because we feel hungry, but we're really dehydrated. So you know, it's like my husband gets up at dark 30, and the coffee tastes good, but he just keeps drinking it because it's a habit, not because he needs the energy or he needs to stay awake or whatever, because he's naturally a morning person. So check to see if it's a habit, and instead of, you know, before every glass of coffee you have a glass of water. And have our water. So when you're going to detox off of caffeine, what I suggest, if you're making your own coffee, go with like a quarter decaf grounds and 3/4 caffeinated for like three days, and then go like a 1/3 and 2/3, or a 1/2 and 1/2, and then 3/4 and 1/4, and just slowly increase the amount of decaf that you take to caf until you get to where you're all decaf. And then like I said, in the meantime, have a glass of water, and you may find that you really don't want to have that coffee. As we say, when you drink 2 glasses of coffee, a cup of coffee, you need to have 2 glasses of water, because caffeine is a diuretic. And if you think about it, I'm telling stories on my husband, but you know, he can go all day long without having to go to the bathroom once it's been past the afternoon. But when he's drinking coffee, he's in there, you know, like every hour, because it truly is a diuretic. Its job is it's concentrated, so it's pulling water out of the body to try to balance and to try to make that coffee less concentrated, so it's dehydrating us. So half your body weight in ounces of water a day, plus 2 cups of water for every caffeinated product that you drink. Okay, so
other thing, whenever I hear migraines, I always think of calcium and magnesium.
Yeah, sometimes. Most of the time, though, here's where my osteopathic profession comes back in, because I can feel the structural piece. Migraine is kind of a bucket term that gets used by patients. They always say, I have migraine. And even by physicians, because if they're not osteopathic, have not been trained, they do not have the ability to feel the musculoskeletal system. And I can tell you that about 60% of the time, I can take somebody who has a migraine, find out it's a structural problem, fix that structural problem, and help them. Therefore, what happens is these magnetic necklaces can work really, really well when it's really a musculoskeletal or a tension headache that has been mislabeled as a migraine. And the earrings that we have also will sometimes help. So my quick testimony, when I was first started, I was looking for a business, but Herb Rapp loaned me a necklace so I would have something to do testing and strength testing on people. And I had throwing up headaches for years. And they would last 2 or 3 days, and I even, if I got a massage early enough or got somebody to give me a treatment, I could head it off at the pass. That was 16 years ago. I have not had a throwing up headache for 16 years, and you will not get this necklace off of my neck if it's the last one on the planet. My massage therapist broke her leg, and I didn't see her, instead of every week, I didn't see her for 7 weeks. When I laid down on the table for the first time in 4 years, she couldn't find a trigger point on me to levitate me off the table. And I realized that I'd gone 7 weeks without a headache, and that had never happened. It did 2 or 3 days, you know, a month, every 3 weeks or so. And the story was that I would be working urgent care, and I'd walk in and I'd see the patient, and I'd say, you know, how are you doing? What's the problem today? And they'd tell me, I say, excuse me, and I'd go throw up. And then I'd come back and I'd say, okay, so what, have you tried for that, done this, done that, excuse me, and I'd go throw up. I would do that all day long. Because I ran an urgent care, I couldn't just shut it down like I could a private practice. And so if I didn't have anybody to cover for me, I was like done. And I would start to panic when I would feel it happen. And for me, it's because I have a scoliosis in my upper back, and if I wore a different size shoe, like by a 1/2 inch, because I stood when I did my charting, that 1/2 inch made all the difference in the tension in my neck. So now let's talk about the fact that we shoulder holster the phone, that we sit in front of computers that are not ergonomically designed for us, our chairs are not correct, and we have all kinds of issues with our back. Besides the electronics that are transmitted to us, that we're not being compensated for if we're not sitting in a Kenko seat, if we're not wearing insoles, if we're not wearing a necklace. Those kind of things can help to compensate for the stress. And I know everybody's got stressful jobs. So what happens with their stressful jobs is we put our attention here, we're working on the keyboard, and sleeping on a sleep system, using the water to detox and relax those muscles and get the waste products of metabolism of us being tense really makes a difference. So wow. You went away, Dave. You just went black.
Oh.
Oh.
Okay.
What's the next question?
All right. There's a person that just in the last few years keeps getting recurrent boils all over, and the doctors say we don't know what to do. Is there anything that Nikan could help with as far as preventing or helping with boils? And what is a boil exactly? Okay,
so boil is an infection of the skin. A lot of times it starts with the hair follicle. So remember that our second largest detoxifying organ is the skin, okay? And so I would think a couple things. I would say, let's take a look at what you're putting into your body. What kind of chemicals are you ingesting, absorbing? You know, what about cosmetic products? What about your soaps, etc.? Go to hypoallergenic type things, go to organic things, get rid of the chemicals because your body is trying to get rid of that. The next thing that's important is that for our hair follicles and our skin cells to work, they have to be hydrated because they're flushing. And so if you want to wash that car, that brand new dirty car with just a wet sponge, then keep on not drinking water. But if you want to have the skin to do its job, try to hydrate yourself. So I would even up from half your body weight in ounces a day of water to more than that. So then the next thing is what kind of things are you putting on your skin, and what kind of soaps are you using? And I would go to all of our skincare. So basically it's going to be check what you're putting in, replace it with nutraceutical, pharmaceutical grade, basic foundational nutrition. Get the skincare products, and because they're fabulous, and they don't have chemicals, etc. Use the soap. You can use the soap for the hair too. You can use that instead of a shampoo, and drink lots of water. So yeah, a lot of times what happens is that the skin has staph, which is normally on the skin. But when we have damage to the hair follicles, there's an opening in the skin, and that bacteria gets underneath where it doesn't belong, and it causes those kinds of infections.
That is really one of the purposes of skin, is just to be a barrier to protect us. And also, like you mentioned, skin is an organ, and it's a limitative organ. You know, helps us eliminate toxins and things like that. And would lactoferrin help with something like that?
You know, anything that helps our immune system is going to help. So the bone health is going to help. The lactoferrin is going to help. Probably the immunity is going to make a difference also. Now, with my Western medicine hat on, what I would say is that sometimes people are staph carriers in their nose. And so what we do is sometimes you have to go see your doc and get a prescription, but sometimes what we do is to treat the nose of everybody in the family with a mupirocin, which is a strong antibiotic cream, twice a day for 5 days, and then that usually wipes out the carrier status of that staph, so somebody's not exposing somebody in the family to it and causing it to be recurrent. Those would be the other things I think about.
Okay.
That'll be $100, please, for now.
All right. Okay, someone is having 4 or 5 teeth extracted next week. Oh my goodness.
I'm sorry.
So, what can you do to help her overcome her pain and swelling and get her back to work?
Where is that Power Mag? Where is that Power Mag?
You know, you could put a power chip.
Yeah, I know. I'm just trying to, put it in there for Jeff to get going on that Power Mag, get it back to us in whatever new name and form it's going to be in. Okay, so my experience with having my wisdom teeth out. Did you ever wonder why we call them wisdom teeth and then take them out? That just One of the things that's painful is the swelling that happens. And so I remember even waking up, and I said to the dentist, I said, so I want ice on this side when you're working on this side, because I'm not coming back to sit in this chair. And I remember waking up from the anesthesia just to make sure I could feel ice on this side, and they were working on that side. But if you can eliminate the swelling, that's going to make a huge difference. So getting ice on it during the procedure, right after the procedure, is important. As far as the Niken products are concerned, let's see, could we just take if it's a small head, we could just take a Kinkle-Therm knee extra large and put it around. Maybe wrapping with the comforter, certainly the chips, the power chips, along wherever the teeth are being removed. Having good nutrition and the immunity. I mean, the nutrition we talked about, Siaga, jade green, the protein, having the protein drink for your meal replacement, throw the Siaga in it, throw the jade green zymes in it, make that power shake with it. For good nutrition, once again, the same concept that we talked about with chemotherapy, you got to have some nutrition to be able to heal. And then if you know somebody who's got a power mag, borrow it.
Yeah, I just sent a little thing. If you could,
about power mag.
Wobenzime, which is a proteolytic enzyme supplement, go heavy on that, and that seems to help quite a bit. We've always just bought a bottle of that right before the procedure, and then the doctor gives a prescription for pain and antibiotics, and we just take them home and load them up on those. About half a dozen every half hour, and that seems to help with anti-inflammation and pain and stuff too.
Yeah.
But
probably swishing with the water, swish and spit, and then drink also. And you probably have a lot of experience with that, with the few children that you have and your grandchildren, right?
And anything with surgery, that's connective stuff, and so it's always a good idea to take extra vitamin C too. But let's see, we better get moving to these other ones. Let's see. My wife has bone-on-bone in her knees. Wow. We've kind of talked a little bit about some supplements for that.
The joint, for sure. When the joint first came out, we talked about the fact that they tried to kill mice with what's called the LD50, try to overdose them, and they couldn't get one more morsel in the little mice's tummies, and they never had any side effects or problems with it. So the acetyl myristoyate is very extremely helpful, and if it takes a while to get enough in our fat cells in our stores so that the body will pull it to where it's needed. So you might start with the CM cream every couple hours during the day on the knees, and then in the meantime, maybe start with 6 joints a day and do that for a week or two to get it kind of the tissue loaded.
Fill up the tank, yeah.
Yeah, fill up the tank, and then you can go back to like 2 a day. But the other thing that people really find helpful with knees is wearing the magnetic insoles and using the Kinkle-Therm wraps, and sometimes the Kinkle-Therm wraps with the power chip on either side of the knee. I'm not sure if it's true about with people, but it probably is. I know when we use technologies on horses, if we're treating the right front leg, we also need to treat the left front leg. So we need to keep the body parts in balance on the horse. It's probably true on the people too. So a chip on the outside, chip on the inside. You can, because of how they've designed them, which I just love, they've got the little hook, you can pin them into the Kinkle-Therm wraps so you don't lose them, because we used to put them in and lose them, right? Or we have to tape them down. And okay, so the insole, yeah, and the osteodents, yeah. And sometimes what's good is if people have foot or leg problems to actually wear a pair of little like tennis socks and put your insoles with your feet at night when you're sleeping. So you got it 24/7. Mm-hmm.
What's the best time to take the 3 components of the Bone Health Pack?
We absorb our calcium at nighttime. Gary, help on this one. I don't remember exactly. I think nighttime for the calcium.
Yeah. Plus, it's a nice relaxer. Helps you sleep better too. So.
Yeah. Was there anything else about the Caldens or the lactoferrin? We should be taking them all kind of at the same time. The lactoferrin helps us to absorb the calcium and the osteodents. Yeah.
Yeah. And I don't think it's that important, really, when you take those, but I usually suggest take the calcium in the evening.
What I tell patients, there's some medications that I prescribe, like the statins, that are better, that work better at nighttime because that's when the liver is busy. But if patients can't remember to take them at nighttime, I'd rather have them take them anytime they can remember them than to not take them at all.
The most important is take it anytime.
Yeah, take it. Yeah. If you're really good or you're doing something else that you can hook it up to, a lot of times you just need to hook up a habit to make it a habit. It says 21 days to make a habit. And so hook it up to something else you always do, like you always brush your teeth at night, or you always take your hair down, or whatever you do.
And just from common sense, I like to take lactoferrin in the morning to help me with absorption of nutrients and everything throughout the whole day. So
yeah.
Couple of other questions about osteodents. Vitamin K is a good thing. It used to be in there, but a lot of doctors have said, oh, what you're doing with your regime, you shouldn't be on K. And so Niken responded by taking vitamin K out of the Bone Health Pack. And also a question, would this interfere with blood thinners or high blood pressure meds? So those are a couple of questions.
Okay. So we have multiple types of blood thinner meds now. You see them advertised on television. So warfarin or Coumadin is the one that vitamin K interferes with. There's 4 vitamins that are fat soluble and stored: A, D, E, and K. ADEC. And so you have to be careful about not getting too much, so that they actually become, instead of a supplement, they become a toxin of A, D, E, and K. And so what I usually do is I'll have people check the little box, the little supplement ingredients on there, and see. Now, what we know historically is that the recommended dietary allowance, the RDA, is probably a little bit low. We can probably go above that. But on those vitamins, A, D, E, and K, you don't want to be 5,000 or 10,000 times the normal RDA. And what you have to be careful of is I'll have people come in who bring a bunch of supplements to me, and there's some of each one of those things in all of those supplements. So you kind of have to add those up. Okay, so here's the deal with Coumadin. Vitamin K basically clots the blood, or it keeps Coumadin and warfarin from working. And so if anybody wants to take something that has got vitamin K in it, or if they want to have a green leafy vegetable, because it's the spinaches and our barley grass, the green leafies usually tend to have vitamin K in them. What they need to do is to take the same amount every day, talk to their doctor, and have their INRs checked more frequently so that it can be adjusted. There's a certain range that we have to keep our INRs in for certain problems so that we don't clot, okay? And I lost my first husband because he thought the four food groups were pizza, beer, peanut butter, and French fries, right? And then he had a St. Jude's valve put in, and they put him on Coumadin, and then he decided he was going to eat right, so he was going to have salad. And I said, Tom, if you're going to have salad, you have to have the same color salad and the same amount, and you have to have it every day. And he says, oh, I am, and he wasn't. He was having the dark green one day and the whiter, firmer the next day, and a bigger bowl and a smaller bowl. And so his INRs were all over the place. His poor doctor didn't realize what he was doing, and so he was trying to chase this around to get it right. And I found him on the floor having had a stroke and a heart attack because he clotted. And so you have to be very respectful of rat poison, because that's what Coumadin is, okay? Warfarin and Coumadin are rat poison. And they discovered that it worked for people who had clotting issues because that's how we kill rats. We cause them to bleed to death. And that's how that transition was made. And so it's a great drug. It's a scary drug. You have to be doing what you're supposed to be doing, talking to your physician, getting your blood counts checked. And if you change anything, you need to talk to your physician, get the baseline, then change what you're going to change, eat the same amount every day, never quit, and then in a 3 or whatever they want to do, 3 to 5 days, recheck the INR and make sure it stayed in the range, because sometimes what we have to do is increase the amount of Coumadin to compensate for the amount of vitamin K that they're getting. Did I answer all those questions?
Maybe blood pressure.
Vitamin K has nothing to do with blood pressure that I know of. How about you, Gary?
No, Osteodense.
Osteodense.
Just supplement Osteodense blood thinner and blood pressure, which I've heard could help on blood pressure because that's affects calcium metabolism so much. But also I would suggest trying Virgistrol. I have a friend who's a pharmaceutical rep, and when he was looking at the numbers on Virgistrol, the clinical studies, he says, "Wow, this is better than our drug," and with no downside. So
yeah, it's great, and Annie Ng does a wonderful job on YouTube. Look at those. Watch her talk about the study she did. It's impressive. It really is. You talk about evidence-based medicine. That's where it's at. So the only relationship to blood pressure that I can think of is that we use a category called calcium channel blockers. Help, Gary. What about osteodense and blood pressure? Can you hook it up?
Well, if we reestablish normal calcium metabolism, that's going to help with blood pressure. I mean, every time a muscle beats, it takes calcium to do it.
As does the heart.
Our heart as well. Yeah. So.
Yeah. Okay.
That's a simple answer.
Okay.
Okay, we got maybe a Stump the Doc question here. Type 1 neurofibromatosis.
That one's yours, Ash.
Neurofibromatosis. Okay.
And what could Nikan do to help that? Get a wellness home.
Yeah, that's the right answer. I got to go back and think about the physiology of that one. They get little kind of tumors.
Cysts around the nerves.
They're like a little nerve tumor that happens. And as I recall, they're painful. Did they talk at all about the symptoms they have from it?
Just suggestions. Doesn't sound fun anyway.
Okay, well, up to date, here I come. I'll bring that one back next week. But yeah, you really kind of have to tell me more of the symptoms that they're having. As I recall, it's pain. And so all of the things about remember that that we are a magnetic being, and a lot of times, like if we use magnetics in the lumbar spine for somebody who's got pinched nerves back there, part of the problem is that the nerves swell, and when the nerves swell, they hurt and they fire, etc. So there's magic about decreasing that swelling, and magnetics tend to do that. So with that in mind, if there was a certain area of their body where these little tumors are that bothered, I would probably try the patch. I would try the Kenkeltherm. I would have them use the sleep system. Anytime you have pain, you have inflammation, so we might be able to go to the sciaga and to the joint as far as helping to decrease the inflammation.
They just elaborated here. Since tumors are in the brain.
Oh, in the brain.
Yeah, not fun.
Sleep system, good nutrition, necklace. Yeah.
Yeah. Oh, shucks. Also, how about Bell's palsy? Anything you'd recommend for that?
Yeah. So Bell's palsy is a virus attacking one of the facial nerves. We have, if you put your hand up like this, we have 5 branches of the facial nerve that comes out right here in front of the ear. And depending upon which branches or all of them that get attacked by the virus, it causes the drooping. The problem with that then is people have a hard time speaking, they have a hard time swallowing, they have a hard time eating, their eye won't close. So a lot of times what we have to do is we have to tape their eye shut, because when they sleep at night it doesn't blink and they get a dry eye.
And it's just plain not very attractive either.
Yeah, it's very frustrating to them. And usually it gets better, but not always. I have a darling patient who's 94 who lives in an assisted living, and he's had it for like 18 months, and he's like losing weight like crazy because he can't swallow, and they keep feeding him a regular diet, which he can't eat because he can't get it in and he can't chew it, and he has a hard time getting it down. So for those folks, we're going to go to the protein drink. We're going to add the Sciaga in it, the jade greenzymes in it. I would throw some immunity capsules in there, and have them, use that 2-3 times a day as a nutrition boost. I would put the power chip right here. I don't know I would try CM cream. I don't know. It might make a difference, but I'd probably try CM cream on that side of the face, remembering that how the branches go is kind of like this. There's 5 of them. That was my best dissection, and I'm so obsessive compulsive. I just got all 5 of those branches. It was
lumbar
I'm still proud, 40 years later. Okay.
A question about lumbar DDD. Osteodents, would that be useful?
Lumbar DDD? Degenerative disc disease?
Yeah, all capital DDD.
I love acronyms. A degenerative disc disease is what I'm thinking that is.
That would.
But that's not DDD. Degenerative disc disease. Oh yeah, it is degenerative disc. We never use that acronym in medicine. So anyway, we use DJD, which is degenerative joint disease, but not DDD. Okay, I'm on the page. Okay, so as we were just talking about, so what happens with disc disease is the little cushion in between the bone kind of gets worn down and it collapses. When it does, it narrows the space that the nerves come out of. And so those nerves start to get pinched and they start to swell. And then what happens is they fire, and when they fire, they shorten the muscles down in the back. And so people tend to have tight muscles. It hurts when they move. They're pinching the disc, they're squashing the disc, and that's pushing out against the nerve, which causes the nerve to swell. So when you do a rollout, when you sit on a Kenko seat, when you sleep on a sleep system, when you use a MagFlex, all of those things tend to relax the muscles. As soon as you relax the lumbar muscles, then it quits compressing the discs, and the discs can go back into the space that they're supposed to be in, takes the pressure off the nerve, then the nerve doesn't swell. The other side effect of the tri-phase technology that we have in our products is it decreases swelling. And if you go back to one of the first 2 presentations I did, I talked about the far infrared, and I showed you the picture of the lady who had a swollen knee after knee replacement, and my dog Sam, who got hit by the car, and how that Kinkotherm wrap had decreased that swelling very quickly, less than 24 hours on the lady and less than 6 hours on Sam. And so if we can decrease the swelling, we cannot change the bony case that disc and those nerves are out. We can't fix that. And when you have wear and tear, what the body says is, oh, I'm getting worn and torn on, I need to make more. And so it starts to make more bone. The problem is it makes irregular bone, which is what the osteoarthritis is. And that irregular bone comes out where the nerves come through and where the discs are. And it rubs and it irritates. It's like putting a stone in your shoe, a pebble in your shoe. And so we can't do anything about that bone because that'd have to mechanically get carved away or taken away. But we can decrease the swelling. So if we take a hole that's this big and we've got something that's this big in it, and we decrease the swelling, so now that nerve can move in that hole, we decrease the pressure on the nerve and thus the side effect of pain. So MagFlex all the time, first moment you get up till you go to sleep at night, sit on the Kenko seat, in the car, in your chair in front of the television, at work, wherever that is, carry it with you, sleep on a sleep system. Insoles sometimes help also. People, with our new ones, people were saying that they could feel it all the way up into their pelvis when they had problems, and so I would certainly be in insoles.
That sounds good. Someone has a torn knee ligament, and they're asking specifically about supplements.
Okay, that's going to be the joint. That's going to be the CM cream.
Osteodents?
Yeah, bone health pack wouldn't hurt too.
Yeah, bone health won't hurt. You know, it's not super specific to the cartilage piece, but yeah, it wouldn't hurt. It's going to stop some of the inflammation. It's going to help with the inflammation that's going on there. Support with the Kinkotherm to take the swelling down. The power chips that we talked about, the insoles. That's all I can think of right off the top of my head, and the CM cream.
Dave, I've got one that Nina Marie texted me, if I might just ask for a minute. Young child in his teens, bring up his vitamin D level. What are the side effects they may experience when their body stays low in vitamin D? So I will just start by saying that nearly 69% of our population are low in vitamin D. A lot of times just 20 minutes of sunlight a day is very, very beneficial if they have a good, healthy diet. So,
Yeah.
Ash, from there, go ahead.
Yeah, so that's true, and that's what I tell my patients. You know, we didn't used to all check vitamin Ds, but now that's like the rage. So we check vitamin Ds on everybody, and it's very interesting because I live in Ventura and we're on the coast and we're on the beach. I hardly ever get low vitamin D levels, and any place else I've ever worked, like up in Napa, etc., everybody had low vitamin D levels. And kind of the rule of thumb was if you live north of the Atlanta latitude, you're probably going to be low in vitamin D. So the 20 minutes a day is not going to get you skin cancer. It needs to be your face, it needs to be your chest, and it needs to be your arms. And I've had people who do that, and I've seen their vitamin D levels come up. It needs to be between 30 and 100. Remember, A, D, E, and K are toxic, so you have to be careful. But I never have had anybody with toxic levels of vitamin Ds, and I'm checking them all the time.
Unless it's been recommended that they really over-supplement. I mean, I have seen some of that just because there's some information out there that really is almost a hypertoxicity of vitamin D with some supplements that are out there. So you kind of watch that too. So.
And I think that happens when people are on multiple supplements and they don't sit down and see what is in this one plus that one. So that's where I want you to check the A, D, E, and K. And so what happens is that you need vitamin D to absorb calcium. And I can't remember that pathway either, Gary. But I know that if you don't have it, it don't work.
Yeah.
And if you don't have calcium absorption, remember we replace our skeleton 7 times in our life, and so you don't get new bones if you don't absorb the calcium. So then you're at risk for osteoporosis and osteopenia, which is the step before osteoporosis. And we are projecting that we're going to have young children in their 30s who have osteoporosis ahead of their time because of the caffeine that they drink, the sodas, etc., which leaches the calcium out of the bones.
You know, I've got a good friend of mine who's a radiologist, 30-plus years. He can look at an X-ray of a teenager and pretty much tell me how many sodas he drinks a day.
Yeah.
I mean, he says I have seen more fractures in teenage and preteen kids in the last couple of years than I've ever seen in 30 years of being a radiologist.
No, so here's the important thing about that, and they can't see it until you've lost 30% of your calcium, okay? So that means that those kids have lost 30% of their visually.
Sure.
You know, and I've been privy to talk to a couple people recently who are athletes, and athletes tend to get stress fractures. And so I would definitely have them on the bone health to help prevent and or to heal stress fractures, because if you take somebody who's used to running and they have that endorphin, that morphine-like substance released from exercise, and you say to them, I'm sorry, you broke your foot, you got to sit down for 6 weeks, they're going to go stir crazy. They're going to not like it at all. So we want help to prevent that by giving them good, strong bones.
Yeah. And with that, here's a great opportunity to promote one of the events we're going to be doing on July 13th, I believe, with Karen Messersmith, who's a marathon runner, Iron Woman, Iron Man competition. And she's going to be talking about self-care, the Nika and Wellness Home, for performance, for athletics, and just about for anybody, weekend warrior or not. So
my wife just said awesome.
Yeah.
Here's a friend, Phil Hansen. He's a bicycle fanatic, but he just had a stroke. He's I think he's 70 something. Anyway, he was having trouble with balance after the stroke, and he got on Ciaga and Bergistrol, and he said it really made a positive improvement on that problem. One other comment here. Someone says, what's the difference between Nika magnets and store-bought magnets? So I'm assuming like Radio Shack or something like that. What's stopping me from using store-bought magnets for my health?
They'll both hold things on the refrigerator. They'll both hold paper on the refrigerator. They'll both do that. Yes, that's about where the similarity stops. Okay. So Nika Magnetics, the research and development, and how many times have they been improved upon? 5, I think, 5 or 6 days.
Oh, a lot.
Yeah. What they do is they go in and they study how magnetic fields work on the body. And when I first started, I was taught that that for a magnetic field to make a difference, it has to be perpendicular to the body part that it's attempting to energize. And so what happens, and I certainly can't explain the physiology or the workings of our Dynaflux magnets, etc. But those folks, what are a lot smarter than me around that energy medicine stuff, have put their heads together and understanding how magnetic fields affect the body, have created the different various Gauss ratings that our different magnetic fields have. And what they tend to do is, you'll notice that all our magnets are not the same. They have different Gauss ratings. So some are lower, some are higher. You know, necklaces will tend to be maybe around 1,000. Insoles used to be 450. I'm not sure what the Dynaflux ones are. Do either one of you know what the Gauss rating is on those? But the bottom line is that the research and development component has designed these products to have the amount of energy needed for the body part application. And so there's been, you know, millions of dollars in R&D put into our magnets, and the only thing that's similar about those and store-bought magnets is that they're magnetic.
Well, there used to be a few companies that tried to make stuff that were, you know, pretty available, like magnetic insoles. And I had a friend that he would actually got kind of cocky, and he bought several brands, and that was part of his demo, which I don't recommend because that takes too much time. And why complicate it all? But it was impressive that then you can consistently, you could tell the difference. It worked better.
A lot of times, some of those that people maybe bought at a different drugstore or whatever, when we were doing some balance and energy, you know, demonstrations, would make them weaker because really they weren't a type of energy in tune with the body. And I'll just jump in and say that I'm a big advocate of the new design and the Dynaflux. You know, this is an absolutely brilliant design. What they've done is been able to take a static magnet that actually pulses its field, and that's without using electricity. And that's huge.
What that does is that penetrates the body part
deeper.
Deeper, so you're getting more energy deeper into the body.
Yeah, I mean, it's a brilliant design. It absolutely is. So.
When the new insole came out, I had a friend who was a real train wreck, been in a lot of accidents, lots of problems. The old insoles helped him a whole bunch, and as soon as I got the new ones, I went over to see him. And in fact, I took his old ones out, put the new ones in, and said, try these. And he got in, and I just said, stand up. And as soon as he stood up, he got a big smile, and he actually stood up straighter than before. And I said, let's go for a walk. And he was walking faster. And he commented, it says, you know, going from nothing at all to the old ones, there was a bigger difference going from the old ones to the new ones.
That's huge. That's huge.
All brand X.
Yeah.
Yeah.
Well, listen, guys, I got to jump off. It was fun.
Yeah.
So.
Okay. See you next. Oh, so we're going to make that announcement that on July 2nd, everybody's going to have a happy 4th of July, and we're not going to be here.
Yes, and also on 4th of July, there probably won't be a Monday call. I'm pretty sure about that with Rick.
The whole weekend off and celebrate our independence and the fact that we live in the best country in the world.
Yeah. And on Wednesday, which is what, the 29th, we're going to have a special presentation with Rex Olson and Sparks Johnson. I'll be on vacation myself, and it's really how self-care matters. So it'll be about
audio and video.
Well, I won't be on, so we don't have an issue there. Because I'm telling you, the cloud hates me. It follows me around like a dark cloud. Just doesn't let technology work for me. But anyways, you'll get some information on that as well. So, guys, we got to start setting up for our meeting. It was a blast. Love you.
Have a great weekend, everybody. And
thanks, everybody.
Thanks.
Take care. All right. Bye-bye.
Bye.